Okay, so today we're going to deal on a most important that's topic, so that is pituitary glands and its disorders. Yeah, before going to these topics, we should know some of the basic things related to the pituitary gland. Here, the pituitary gland is considered as master gland because it performs several functions and it sees them. Okay, so it controls some of the glands functions like a thyroid gland, adrenal gland, and that is gonads. Okay, so it sees all. Okay, so these glands activities. For that reason, it is considered as a master gland. Here, the pituitary gland, it is a that is a very small endocrine glands. It looks like a pea-sized set, and it measures about 0.5 gram or so 500 mg in weight, and it is located in the just below the hypothalamus and the place we call as sella turcica. Okay, so this is regarding the location and size of a pituitary gland. Here, the pituitary gland is very important in not only in the human beings, in every living organisms or plant animals. It is also very important because it performs several functions. So those functions are very important for there is the growth and development of an individual metabolism as well as what regulating a water balance. Okay, for that reason, it is considered as the very essential endocrine gland or a very important endocrine in the human beings. Yeah. The ಮೂರ್ತಿ ಚಿಕ್ಕದಾದರೂ ಕೀರ್ತಿ ದೊಡ್ಡದು like that. It's a very small endocrine gland, but it is a very important gland in the human body. Yeah, it performs several functions. Okay, so it is divided into the two lobes. Here the anterior lobe and the posterior lobe. Here the all, okay, so both lobes acts very important. The it performs a very important functions. Here now come again. So that is anterior pituitary gland and the posterior pituitary gland. Anterior pituitary gland produces the different hormones. Okay, so those are very important to the each and every cells in our body. And within the same way, the posterior gland also it also secretes a very important functions. Here, mainly the pituitary gland also we call as in hypophysis. Here, the anterior pituitary gland is considered it is also called as an adenohypophysis, and so the posterior pituitary gland also we call as neurohypophysis. Right. Here, the anterior pituitary gland secretes the different hormones. So the growth hormones, THS hormones, ATHS hormones, FSS hormone, LH hormone, and the prolactin hormone. Okay, so these are the different hormones secreted by the anterior pituitary lobe. Now come to the posterior pituitary lobe. Here, the posterior pituitary lobe it secretes two important the hormones. The one is ADH hormones and then it's oxytocin hormone. Now come to the anterior pituitary hormones and its disorders. Right. Here now come to the growth hormone. The growth hormone also we call as somatotropin hormones because it is very important for the growth and development of human beings. Here, the excessive secretion of that is growth hormone may cause gigantism. It means increase height of an individual is called as that is gigantism. Okay, so gigantism usually occurs before the puberty of a child. Now come to the acromegaly. Here, acromegaly. Acro means extremity. Okay, so legs and hands. The megaly is nothing but enlargement. It means enlargement of extremity. The great Khali, so that is WWE champion, he also suffer from this acromegaly, but utilized and succeed in life. That's because of acromegaly. Okay. Now come to the dwarfism. Dwarfism is nothing here. Acromegaly usually occurs after the puberty occurs. If the excessive secretion of growth hormone after the puberty, it is considered as acromegaly. Before that, if the growth hormone secretes more before that is puberty, it may cause gigantism. The pituitary gland that is growth hormone secretes the more after the puberty, it may lead to acromegaly. Now come to the dwarfism. The dwarfism is nothing but it is also called as pituitary dwarfism. It means there is a less secretion of that is growth hormones take place for this reason. So that is a short stature. Okay, with normal that is bodily functions. In the Hali Mistress of film, so there is comedy actor, so there is Kaperaya also support forms for this kind of that is dwarfism, pituitary dwarfism. Now come to the thyroid stimulating hormone. So thyroid stimulating hormone is very important because it just stimulates the thyroid gland to produce the T3 and the T4 cells. Suppose thyroid TSS hormones, okay, so the stimulating more means it may causes so there is hyperthyroidism. It may secrete less means it may causes so there is hypothyroidism. Right. Now come to the ACTH hormone. Here the ACTH hormone is also very important. So performs are very important. So the functions here The ACTH secreting more means it may cause a Cushing syndrome, excessive secretion of ACTH hormones. So from the pituitary gland, it may lead to so that is a Cushing syndrome. If the ACTH is secreting less, it may cause so that Addison's disease. Now come to the FSS. Here the hyper and hyposecretion of FSS may lead to so that is the infertility and so that is some. Okay, here the FSS and the LHS. Okay, so these are very important hormones. It plays a very important role during the so the puberty or appearance of the secondary sexual characteristics. Okay, so if any changes in secretions in the so that is puberty, it may causes the different so that functions. Here that it causes infertility. Not functioning properly, so the fetus is not producing properly means it may cause that is infertility. Because the LHS is the most important hormone. It is responsible for the ovulation. So ovulation is nothing but the release of egg from the so the Graafian follicle is called as so that is ovulation. If the secretion is less means so it may causes so that is ovulations. And also secretions more means it also causes some of the disorders like PCOD, the PCOS, that is polycystic ovarian disease or a polycystic ovarian syndrome. Here it may also causes if any changes in the so the FSS and LHS secretion inside also causes so that is defect in the sperm productions and case that is spermatogenesis. Now come to this last one is prolactin. Here the prolactin hormone is nothing but it is very important in the milk secretions. If there is a hyperfunction of so that is prolactin hormone, it may cause some of the so the deformities like galactorrhea, excessive secretion of milk. The options of so that is not functioning properly means there is no milk productions. Okay, so this is regarding to this that the different hormones secreted by the anterior lobe as well as and its defects and disorders. Now come the posterior pituitary gland. Here the posterior pituitary gland also is not having a capacity to secrete different hormones, but it stores the hormones and secretes whenever the body necessary. Okay, it may cause some of the diseases and disorders like first hormone is ADH or antidiuretic hormone. Here antidiuresis means so that is a continuous urination, so that is here anti means it prevents the it is helpful for so that is water retention, but excessive secretion it may lead to excessive water retention. It may lead to so also one condition so that is called as syndrome of inappropriate antidiuretic hormone means excessive water retention. Okay, it may cause a different the defect in the body. So here the less secretion of ADH hormone it may cause so that is diuresis. That condition will called as so that is diabetic insipidus means excessive urinations. Now come to the oxytocin. The oxytocin is very important. It is also called as a love hormone, bonding hormone, and cuddle hormone because it plays a very important role in so that not only so in so that is it not only in the relationship so that is cuddling hormone, it also plays a very important role during the so that is process of labor. Okay, so it is continued here. It is only the one hormone in the body. It works on the so that is a positive feedback mechanism. If the secretion is there means again it secretes. It facilitates okay so the easy delivery of the baby. Also it plays a very important role. It prevents the postpartum hemorrhage means so excessive blood loss. Okay, so during the so that labor it also plays a very important role. Okay, so this is regarding to that is the hormone and its defects and disorders. Okay, so that is from the so the posterior pituitary gland, ADH and the oxytocin. Okay, so this is regarding to the different hormones secreted by the so there is pituitary gland and also its defect and disorders.